After 40, your body may start warning you before a heart attack, but most people ignore the signs because they think it is just stress, gas, tiredness, acidity, or normal aging. This is where the danger begins. A heart attack does not always start like a movie scene, where someone suddenly grabs the chest and falls to the ground. Sometimes the warning signs are quiet. Sometimes they come and go. Sometimes they feel like pressure, heaviness, burning, weakness, sweating, or shortness of breath. And because the signs are not always dramatic, many people wait too long before getting help. But with the heart, waiting can be dangerous. Every minute matters because the heart muscle needs blood and oxygen to survive. When blood flow is blocked, the heart can begin to suffer, and quick medical care can save a life. Many people over 40 say, "I am too young for a heart attack," or "This is only acidity," or "I will rest and see what happens." But after 40, your risk can slowly increase, especially if you have high blood pressure, high cholesterol, diabetes, obesity, smoking history, stress, poor sleep, family history, or an inactive lifestyle. The scary part is that some of these problems can be silent for years. High blood pressure can damage the arteries without pain. High cholesterol can build plaque inside blood vessels without symptoms. Diabetes can affect blood vessels and nerves quietly. Stress can push the body into constant pressure. Then one day, the heart starts sending signals, but the person ignores them. The first warning sign you should never ignore is chest discomfort. Many people expect heart attack pain to be sharp and unbearable, but it may feel like pressure, squeezing, tightness, fullness, heaviness, or burning in the center of the chest. It may last more than a few minutes, or it may go away and come back. Some people describe it as an elephant sitting on the chest. Others describe it as indigestion or acid reflux. This is why chest discomfort is dangerous. It can disguise itself as something simple. If you are over 40 and you feel unusual chest pressure, especially with sweating, shortness of breath, nausea, dizziness, or pain spreading to the arm, jaw, neck, back, or shoulder, do not try to be brave. Take it seriously and seek emergency help. The second warning sign is pain or discomfort that spreads to the left arm, both arms, shoulder, neck, jaw, back, or stomach. Many people do not understand that heart pain does not always stay in the chest. The nerves of the heart can create pain in other areas of the upper body. Some people feel pain in the left arm, some feel tightness in the shoulder, some feel pain in the jaw or neck, some feel discomfort in the upper back, some feel stomach pain or indigestion. This is why people often misunderstand heart warning signs. They think, "My chest is not hurting, so it cannot be my heart." But that is not always true. Heart attack symptoms can appear in different areas, and the CDC and American Heart Association both list jaw, neck, back, arm, shoulder, and stomach discomfort as possible warning signs. The third warning sign is shortness of breath. This can happen with chest pain or even without chest pain. You may feel like you cannot take a full breath. You may feel breathless after small movement. You may feel like your chest is tight and your body is not getting enough air. Some people think it is anxiety, weakness, weight gain, or age. But sudden or unusual shortness of breath after 40 should never be ignored, especially if it comes with sweating, chest pressure, dizziness, or pain in the upper body. Your heart and lungs work together. If the heart is struggling, breathing can become difficult. This is one of the signs many people delay because they think they just need rest. But if it feels new, strong, or unusual, it needs attention. The fourth warning sign is cold sweat. This is not normal sweating after exercise or hot weather. This is a sudden, cold, clammy sweat that appears without clear reason. Some people feel sweat on the forehead, neck, back, or palms. They may feel weak, pale, nervous, or uncomfortable. Cold sweat can happen when the body is under serious stress, and during a heart attack, the body may react strongly. Many people ignore this sign because they think they are only tired or anxious. But if cold sweat comes with chest discomfort, shortness of breath, nausea, dizziness, or pain spreading to the arm, jaw, neck, or back, it can be a serious warning sign. The American Heart Association lists cold sweat among possible heart attack signs. The fifth warning sign is nausea, vomiting, indigestion, heartburn, or stomach discomfort. This is one of the most confusing signs because people often blame food. They think, I ate something heavy, it is gas, or it is acidity. But heart-related symptoms can sometimes feel like stomach upset. Some people feel pressure in the upper stomach. Some feel nausea. Some feel like they may vomit. Some feel burning that they mistake for heartburn. This is especially dangerous because people may take an antacid and wait while the heart problem continues. If stomach discomfort is unusual, intense, or connected with chest pressure, sweating, breathlessness, dizziness, or upper body pain, do not ignore it. Mayo Clinic notes that heart attack symptoms can include nausea, indigestion, heartburn, abdominal pain, shortness of breath, cold sweat, fatigue, and sudden dizziness. The sixth warning sign is unusual tiredness. After 40, many people are tired because of work, family pressure, poor sleep, or stress. But heart-related fatigue can feel different. It may feel like sudden weakness. It may feel like your body has no power. You may feel exhausted after small tasks, like walking to the bathroom, climbing a few stairs, cooking, or getting dressed. Some people feel heavy, drained, or unable to do normal activities. This warning sign is especially important because women may experience unusual tiredness and weakness along with other symptoms. The American Heart Association says women can have symptoms less commonly associated with heart attack, including shortness of breath, nausea, vomiting, upset stomach, shoulder, back, arm pain, unusual tiredness, and weakness. The seventh warning sign is dizziness, lightheadedness, or feeling like you may faint. When the heart is not pumping properly or blood flow is affected, the brain may not get enough oxygen-rich blood. You may feel unstable, weak, or suddenly dizzy. Some people feel like the room is spinning. Some feel like they may pass out. This can be scary, but many people still ignore it. They drink water, sit for a while, and hope it passes. Sometimes dizziness can be caused by many other things, but when it comes with chest pressure, shortness of breath, sweating, nausea, or upper body pain, it must be treated seriously. Do not drive yourself. Do not wait alone. Get emergency help. The eighth warning sign is pain that comes with activity and improves with rest. This can be a sign that the heart is not getting enough blood during exertion. For example, you walk fast, climb stairs, carry groceries, or feel emotional stress, and suddenly you feel chest tightness, pressure, breathlessness, or arm discomfort. Then you rest and it improves. Many people think, it went away, so I am fine. But repeated chest pressure or angina-like discomfort that does not feel normal can be an early warning sign. Mayo Clinic notes that some people may have warning signs hours, days, or weeks before a heart attack. And chest pain or pressure that keeps happening and does not go away with rest may be an early warning sign. The ninth warning sign is silent or unusual symptoms, especially in people with diabetes. Diabetes can affect nerves, and sometimes people with diabetes may not feel typical chest pain clearly. They may feel weakness, sweating, shortness of breath, nausea, or unusual fatigue instead. This is why after 40, if you have diabetes, high blood pressure, or high cholesterol, you need to be extra careful. Do not wait for classic pain. If your body feels seriously different, especially with breathing difficulty or sweating, get checked. The 10th warning sign is a feeling that something is seriously wrong. Some people describe a strong sense of doom, anxiety, or panic before or during a heart attack. Of course, anxiety can happen without heart disease, but if this feeling comes suddenly with chest discomfort, shortness of breath, sweating, nausea, dizziness, jaw pain, back pain, or arm pain, it may not be just anxiety. Many people make the mistake of telling themselves to calm down while their body is sending a real warning. If the symptoms are unusual and intense, treat them as serious. Now, here is the important part. A heart attack can look different in different people. Some heart attacks are sudden and severe. Some are slow and confusing. Some people have chest pain. Some have no chest pain. Some have stomach discomfort. Some feel shortness of breath. Some feel extreme tiredness. Some feel pain in the jaw, neck, back, shoulder, or arm. Women may have chest discomfort too, but they are also more likely to experience symptoms that people may not connect with the heart, such as nausea, shortness of breath, back or jaw pain, and unusual fatigue. This is why awareness is so important. A person who knows the signs can act faster. If you suspect a heart attack, do not wait to see if it gets better. Do not search online for too long. Do not try to sleep it off. Do not drive yourself to the hospital. Call your local emergency number immediately. In the United States, that is 911. In the UAE, emergency ambulance is 998. Follow the instructions from emergency services. Quick care can save life and reduce heart damage. Mayo Clinic says if warning signs are present, call emergency help right away. Many people over 40 make one dangerous mistake. They try to explain away every symptom. Chest pressure becomes gas, jaw pain becomes dental pain, back pain becomes muscle pain, sweating becomes heat, nausea becomes food, fatigue becomes age, shortness of breath becomes stress. But when several signs come together, the story changes. If you have chest discomfort plus sweating, or shortness of breath plus jaw pain, or nausea plus arm pain, or sudden fatigue plus dizziness, do not ignore it. The body may be giving you a warning before it is too late. Now let's talk about why these signs happen. A heart attack usually happens when blood flow to part of the heart is blocked. The heart muscle needs oxygen-rich blood. If a blood vessel is narrowed by plaque and then a clot forms, blood flow can reduce or stop. The longer the heart muscle is without oxygen, the more damage can happen. This is why time is so important. Fast treatment can open the blocked artery, restore blood flow, and save heart muscle. Delaying treatment can increase damage. But this video is not only about fear, it is about prevention. After 40, you should know your numbers. Know your blood pressure. Know your cholesterol. Know your blood sugar. Know your weight and waist size. Know your family history. These numbers are not just reports, they are signals. High blood pressure, high LDL cholesterol, uncontrolled diabetes, smoking, obesity, poor diet, low activity, and chronic stress can increase heart risk. You do not need to become perfect, but you need to become aware. Start with blood pressure. High blood pressure is one of the biggest silent dangers for the heart. It puts extra force on artery walls and makes the heart work harder. Many people do not feel high blood pressure. That is why checking it matters. If it is high, follow medical advice, improve diet, reduce salt if advised, move more, manage weight, sleep better, and take prescribed medicine if your doctor recommends it. Next is cholesterol. Cholesterol is not always felt, but it can build plaque inside arteries. You may feel normal for years while plaque grows silently. This is why after 40, regular checkups are important. Your doctor can check LDL, HDL, triglycerides, and overall heart risk. Do not wait for pain to learn about your arteries. Next is blood sugar. Diabetes and prediabetes can damage blood vessels and increase heart risk. Many people do not know they have prediabetes. They may feel tired, thirsty, hungry, or have belly fat, but they ignore it. A simple blood test can reveal a lot. If your blood sugar is high, lifestyle changes and medical care can reduce risk. Now let's talk about food. Your heart does not only need emergency care, it needs daily protection. Eat more vegetables, fruits, beans, lentils, whole grains, nuts, seeds, fish if you eat it, and healthy fats like olive oil. Reduce sugary drinks, processed meats, deep-fried foods, refined carbs, and packaged snacks. These foods can contribute to weight gain, inflammation, blood sugar problems, and cholesterol issues. Your plate can either protect your heart or slowly increase risk. Movement is also medicine for the heart. You do not need to become an athlete. Walking daily can help. Strength training can protect muscle. Stretching can support mobility. Regular activity helps blood pressure, blood sugar, weight, mood, and circulation. After 40, sitting too much is dangerous. Your body was designed to move. Start small if you are inactive. Even 10 to 15 minutes a day is better than nothing. Ask your doctor before starting exercise if you have symptoms or known heart disease. Sleep is another heart protector. Poor sleep can increase stress hormones, cravings, blood pressure, and inflammation. Many people over 40 sacrifice sleep for work, screens, or stress. But sleep is when the body repairs. If you snore loudly, wake up choking, feel tired after sleep, or have daytime sleepiness, talk to a doctor because sleep apnea can affect the heart. Stress also matters. Long-term stress can push people toward overeating, smoking, alcohol, poor sleep, and high blood pressure. Stress management is not weakness, it is heart protection. Prayer, breathing, walking, journaling, talking to someone, reducing screen overload, and solving financial pressure step by step can help. Your heart listens to your lifestyle every day. Now let's bring this back to the main message. After 40, do not ignore chest pressure. Do not ignore shortness of breath. Do not ignore pain in the arm, jaw, neck, back, or shoulder. Do not ignore cold sweat. Do not ignore nausea or indigestion that feels unusual. Do not ignore sudden dizziness. Do not ignore extreme tiredness. Do not ignore symptoms that come with activity. And most importantly, do not ignore symptoms that come together. Think of your body like an alarm system. One sign may have many causes, but several signs together can be serious. Chest pressure plus sweating is an alarm. Shortness of breath plus dizziness is an alarm. Jaw pain plus nausea is an alarm. Arm pain plus chest tightness is an alarm. Sudden weakness plus cold sweat is an alarm. When the alarm rings, do not argue with it. Act. The people who survive and recover best are often the people who act quickly. They do not wait for the pain to become unbearable. They do not worry about looking dramatic. They do not feel embarrassed to call emergency help. They understand that a false alarm is better than a fatal delay. If it turns out not to be a heart attack, that is good news. But if it is a heart attack, early action can save your life. This is especially important for men who ignore symptoms because they want to appear strong. Real strength is not ignoring pain. Real strength is protecting your life for your family. And it is important for women because symptoms can be misunderstood or dismissed. If something feels wrong, speak up clearly. Tell the doctor your symptoms. Mention chest discomfort, shortness of breath, jaw pain, back pain, nausea, sweating, dizziness, and fatigue. Do not minimize it. If you have had symptoms before and they went away, do not forget them. Write them down. What were you doing? How long did it last? Where did you feel it? Did it spread? Did you sweat? Were you short of breath? Did rest help? Did it happen again? Share this with your doctor. These details can help. Also, prepare your family. Tell them the warning signs. Keep emergency numbers saved. Know the nearest hospital. Keep your medical information available. Medicines, allergies, health conditions, insurance details, and doctor contacts. During an emergency, confusion wastes time. Preparation saves time. Now imagine this. A man over 40 feels chest pressure after climbing stairs. He thinks it is gas. He sits down and it improves. The next week, it happens again. This time, he sweats and feels pain in his left arm. He still waits. Then one night, the pain becomes stronger. His family rushes him to the hospital. The doctors say he should have come earlier. This story happens too often. The goal of this video is to stop that delay. Now imagine another person. She feels unusual tiredness, nausea, and back pain. She does not have strong chest pain, so she thinks it cannot be heart-related. But she remembers the warning signs and calls for help. Doctors check her and find a serious heart problem early. That decision changes everything. Awareness can become protection. Heart disease is not only an old person's problem. It can affect people in middle age too. After 40, the body deserves more attention. Not fear, attention. Not panic, preparation. Not confusion, knowledge. You do not need to check your pulse every minute or live in anxiety. But you should respect warning signs and build a heart-friendly lifestyle. So here is the final message. Your heart works for you every second. It beats when you sleep, when you work, when you worry, when you laugh, when you eat, when you walk, when you pray, and when you rest. It never takes a holiday. The least we can do is listen when it sends a warning. Do not ignore the signs. Do not delay help. Do not wait for symptoms to become unbearable. After 40, one smart decision can save your life. This video is for educational purposes only and is not medical advice. If you think you or someone else may be having a heart attack, call your local emergency number immediately. Always consult a qualified doctor or healthcare professional for diagnosis, treatment, and personal medical guidance. If this video helped you, like the video, subscribe to BioHealth Lab, and share it with someone over 40. Your one share may help someone recognize the warning signs early and get help before it is too late.